Welcome to my channel Biography Zone.
Battlefield medicine and the problem with antiseptics. Fleming was stationed in frontline hospitals in France, where thousands of wounded soldiers were brought in from the trenches. The conditions in these hospitals were harsh and overcrowded, with limited medical supplies and a high risk of infection. Soldiers who survived gunshot wounds, shrapnel injuries, or bayonet attacks often developed severe bacterial infections due to the unsanitary conditions of trench warfare. At the time, the standard medical practice for treating infected wounds involved the use of antiseptics, particularly carbolic acid, phenol, iodine, and mercuric chloride. These antiseptics were applied directly to wounds in an attempt to kill bacteria and prevent infections from spreading. However, Fleming quickly observed that these antiseptics often caused more harm than good. Instead of effectively eliminating infections, they 1. Destroyed the body's natural healing mechanisms. Antiseptics killed not only harmful bacteria but also the body's white blood cells, which played a crucial role in fighting infections. 2. Failed to reach deeper tissues. Many antiseptics only worked on the surface of wounds, leaving bacteria deep inside tissues untouched. As a result, infections continued to spread internally, leading to gangrene and sepsis. 3. Encouraged the growth of resistant bacteria. Fleming noticed that certain anaerobic bacteria, which thrived in low oxygen environments, were actually more resistant to antiseptics than to the body's natural immune response. These first-hand observations in wartime hospitals convinced Fleming that a new approach was needed, one that could effectively kill bacteria without damaging human cells or weakening the immune system. Challenging established medical practices. At the time, the dominant belief in medicine was that antiseptics were the best way to prevent infections. Surgeons and military doctors had been using them since the 19th century, following the principles laid out by Joseph Lister, the pioneer of antiseptic surgery. However, Fleming's battlefield experiences contradicted these long-held beliefs. He noted that soldiers treated with strong antiseptics often fared worse than those who had received minimal treatment, suggesting that the body's natural immune defenses played a larger role in healing than previously thought. When he tried to present these findings, many of his medical colleagues were skeptical. The use of antiseptics was deeply ingrained in surgical and medical practices, and challenging their effectiveness was seen as controversial. Despite this resistance, Fleming continued his research, meticulously documenting cases where soldiers who received gentler treatments recovered more effectively than those treated with highly concentrated antiseptics. Experiments on wounded soldiers and bacterial infections. To further investigate his observations, Fleming conducted small-scale experiments on infected wounds. He collected samples from injured soldiers and analyzed the bacteria present in their wounds under a microscope. His studies confirmed that white blood cells were essential in fighting infections. Harsh antiseptics destroyed white blood cells before they could combat bacteria. Certain bacteria thrived in the presence of antiseptics instead of being eliminated. He began advocating for the use of sterile saline solutions instead of carbolic acid and iodine. His argument was simple: by using saline, doctors could clean wounds without damaging the immune system's ability to fight infection. While his recommendations were not widely accepted at first, they later influenced improvements in military wound treatment and laid the groundwork for modern antiseptic techniques.